think everybody who's been involved in the vaccination programme can be incredibly proud of what has been achieved, and I thank all kinds of people. Obviously, I thank the scientists who came up with the vaccines. I thank the people who've got it all together, who organised it. But if you look at what's happened in the last few weeks, it's been an unbelievable effort by the NHS. And the doctors, the nurses, the GP surgeries, the hospitals. Of course, the army has been fantastic. The pharmacists have done a great job. They've been assisted by legions of volunteers. But I think one of the most striking things about the UK vaccination effort has been the centrality of GP surgeries, of the NHS, and they've done the lion's share of the work, and it's been really very moving to see it.
If there's anybody at all in the 70-plus category who thinks that they haven't been offered a jab, I don't know whether you know of any, that there are any, what should they do?
Of course, the numbers are very good for the over 80s, for the over 70s, and I think 75, 79 group, you're looking at 99% that have been done. But there are some people who are still to come forward, and I really do urge people to come forward. These jabs, these vaccines are safe, they're efficacious. They will help protect you against disease and against death, and they're a wonderful thing to have. Help protect you, your family, your neighbours, and I think people get that, and that's why they're coming forward in such numbers. But if you haven't yet had a letter and you think that you need one, and you think that you're in the categories concerned, get on to the NHS or dial 119 and we'll fix you up with a jab.
Now, you can't say too much today about the future in terms of lockdown lifting, but the one thing that we seem to be being told by lots of people in Whitehall is that you will attempt to open schools all as one, primary and secondary schools all at the same time, possibly March the 8th if the data allows, rather than staggering that. Can you just confirm that one thing for us?
Well, no decisions have been taken on that sort of with that sort of detail yet, Sam. Though clearly, schools on March the 8th has for a long time been a priority of the government and of families up and down the country. We'll do everything we can to make that happen, but we've got to keep looking at the data. We've got to keep looking at the rates of infection. Don't forget, they're still very high, still 23,000 or so in COVID patients in the NHS, more than at the April peak last year. Still, sadly, too many people dying of this disease. Rates of infection, although they're coming down, are still comparatively high. So we've got to be very prudent. And what we want to see is progress that is cautious but irreversible. I think that's what the public and people up and down the country would want to see. Progress that is cautious but irreversible.
As you go into this week where you study the data and work out what you're going to do next, can you just say a bit about your approach? You want to drive down infection rates, you want to protect the NHS, but once they're low and the vulnerable have been vaccinated, what do you do then? Is it okay for the virus to circulate amongst the 20s, 30s and 40s? Do you learn to live with coronavirus like flu, as Matt Hancock was saying at the weekend?
Well, that's a very interesting question. I think we would like to see the rates of infection come down very low indeed, and that's why we have the tough border regimes to stop infection coming in, and as we get ever better with testing and tracing and enforcing fights against the new variants, we'll want to see those rates really, really low, because the risk is that if you have a large, as it were, volume of circulation, if you've got loads of people, even young people, getting the disease, and a couple of things happen. First of all, you have a higher risk of new variants, of mutations within the population where the disease is circulating. Secondly, there will also be a greater risk of the disease spreading out into the older groups again. And although the vaccines are effective and great, of course, no vaccination programme is 100% effective. And so when you have a large volume of circulation, we've got a lot of disease, inevitably the vulnerable will suffer. And so that's why we want to drive it right down, keep it right down.
you're going to set out more on Monday about lifting lockdown. Can you tell us what kinds of decisions you'll be making then? For instance, will you be giving us dates for when things will reopen?
Sam, if we possibly can, we'll be setting out dates. And just to help people think about what we're trying to do on the 22nd, remember what we did in round about this time last year, a little bit later. We set out a roadmap going forward into the summer and looking a little bit beyond. That's what we're going to be trying to do. And the dates that we'll be setting out will be the dates by which we hope we can do something at the earliest, if you see what I mean. So that's it's the target date by which we hope to do something at the earliest. If, because of the rate of infection, we have to push something off a little bit to the right, delay it for a little bit, we won't hesitate to do that. I think people would much rather see a plan that was cautious but irreversible, and one that proceeds sensibly in accordance with where we are with the disease.
Okay, finally, vaccine passports. The bottom line is that companies are going to require proof that people have been vaccinated. Foreign countries might require proof that you've had the vaccine in order to let you in. You're not going to stop companies and countries doing that, and in the end you're going to end up facilitating that process, aren't you?
I think inevitably there will be great interest in ideas like can you show that you've had a vaccination against COVID in the way that you sometimes you have to show that you've had a vaccination against yellow fever or other diseases in order to travel somewhere. I think that's going to be very much in the mix down the road. I think that is going to happen. What I don't think we will have in this country is, as it were, vaccination passports to allow you to go to, say, the pub or something like that. I think that would be going it a bit. I think that just looking at the future, what we hope to have is such a high proportion of the population vaccinated that when you couple that with rapid testing, lateral flow testing, you really start to get the kind of answer that you're talking about. So I think it's in the context of of having vaccinated a lot of the population as we're already doing, and we'll do a lot more of in the next few months. That the rapid test approach will start, I think, to come into its own.